everyone. I'm here to talk today about sterile field and showing you how to appropriately set up a sterile field and maintain sterility. So what type of situations would you think that you may need to set up a sterile field? Maybe you need this for a wound dressing change. Maybe you have a central line in which you're going to change the dressing. Maybe you have a patient having a surgical intervention or an invasive procedure in which you may need sterile fields set up. So first I'm going to go ahead and when I enter my patient's room, I'm going to wash my hands and perform hand hygiene. Make sure that there are any precautions that your patient may need, that you're wearing the appropriate PPE. And I'm going to identify my patient by using the two patient identifiers, name and date of birth. I'm also going to look in my patient's chart to be sure that this is the correct patient in which I am performing this procedure on. Next, I'm going to look at all of my supplies in which I brought in with me. So I have my sterile gloves here. I'm making sure that if there is an expiration date that it is appropriate. I'm also looking at the packaging to make sure that they're intact and not damaged at all. I have my gauze 2x2, again, just making sure my packaging is appropriate and contained. Looking at my ABD pad. Again, if there are any expiration dates, you're going to want to make sure that you use the supplies in which prior to the expiration date. I have my cotton tip applicators here. I have my sterile drape. So again, just looking at the package entirely. I have my sterile solution. This is a new bottle. Based on your facility policy, you're going to want to make sure that your sterile solution follows your policy. Certain facilities allow healthcare professionals to use a sterile solution for 24 hours. If this bottle had been opened of sterile solution, you would want to make sure that it was dated and timed and that it follows your hospital or facility's procedure. If this bottle was previously opened and did not have a date or a time of when it was opened, you would automatically grab a new sterile solution to use. And then I have my bowl here. Again, just making sure that the packaging is all appropriate and intact. So again, at this point, if at some reason you had to leave your field and your area in which you're going to set up your sterile solution again, or your sterile technique, again, I would wash my hands and perform hand hygiene. You're always going to want to make sure that your setup and your table is at least at waist level or higher. And I'm going to go ahead and open up my drape. When opening the drape, it's very important to only touch a border of 1 inch around the entire drape. So imagine that you have about 1 inch around the entire drape that you're able to touch to maintain sterility. I make sure that I always have a garbage nice and close to discard any of the materials in which I am opening during my sterile field setup. Different facilities have different materials available. So your facility's sterile drape may look a little bit different than this. But basically I want to make sure that the blue side is going to be facing down towards my table. I'm going to gently set this drape down onto my table in which I'm going to prepare my sterile field. Next, I have my ABD pad in which I already observed and inspected to make sure the packaging was intact. You're going to basically also imagine that you have a little bubble around your sterile field. You're never going to want to reach over your sterile field. You would never turn your back to your sterile field. You want to always make sure that your sterile field is directly in front of you because you never want the opportunity for that to be contaminated. I have my ABD pad in which I'm going to open and place on my sterile field and discard the packaging. I have my gauze. Again, I'm utilizing the packaging to open it appropriately. I'm not going to rip the packaging. So again, open my package and drop onto my sterile field. And then I have my cotton tip applicator. Which I'm going to open and place directly on my sterile field. Now in this scenario, my one cotton tip applicator is very close to that 1 inch margin around my sterile field. So in the case that I would need another cotton tip applicator, I would utilize a new package and place a new cotton tip applicator on my sterile field. Next I have my bowl. So I have this sterile bowl. Sometimes this may come in a different package. In this case, there is a nice paper shield over the middle of the package. So I'm going to open and then I'm going to utilize the plastic packaging to secure my fingers around the brim of the bowl. I'm going to take all of the packaging and pull directly away from my bowl. So you can see here I'm utilizing my other hand to hold the packaging materials directly away from the bowl, only holding it with the brim of my hand. I'm just going to place this gently on the corner of my sterile field. Again, you want to make sure that it's within that 1 inch border around your sterile field. Next, I have my sterile solution. So again, if this had been opened, you want to make sure that the date and the time is within 24 hours or whatever your facility policy states. The most important thing when opening any liquid solution is to make sure that the label of the solution is always against your hand. So I would gently open my cap here and I would place the cap face up on my table away from my sterile field, because we have to be sure to remember that this sterile solution is not, only the solution inside of the bottle is sterile. So the cap is not sterile, the bottle is not sterile, it is only the sterile solution inside of the bottle that is sterile. So I'm going to gently pour directly into my bowl. I'm going to make sure that the tip of the opening of the sterile bottle, or opening of the sterile solution bottle, is within 4 to 6 inches above where my solution is going into. So whether you're using a graduated cylinder or a bowl, you're going to be sure that it's about 4 to 6 inches away from the top of that. And then I'm going to place my cap back on my sterile solution. At this time, I have now opened this bottle, so I would date, time, and initial the time that I opened the bottle. So now that I have my sterile field set up, I'm going to go ahead and set up my sterile gloves. So something that's really important that we have to think about when we're setting up our sterile field is maximizing the space that we have available. A lot of times it feels really comfortable to place our sterile field in the center of the table that we're using. That doesn't really allow us a lot of space to apply our sterile gloves. So again, you're going to want to make sure that you're maximizing the space that you have available. And again, you're always welcome to move your sterile field as long as you're only touching within that 1 inch margin. So if you note here, I'm not going over the sterile field, I'm on the side of it, and basically I'm just gonna pull it over here to the side to make sure I have enough room to apply my sterile gloves. So I have my sterile gloves. You're going to want to make sure that these gloves are appropriate for your hand size. Basically, there is a nice picture here once you open your sterile gloves that shows you the direction in which your thumb is. So in this case, I note that my hand should be going into the gloves in this format. A lot of times we get very confused because we naturally want to put our hands in palms facing down. However, once we start to put the gloves on, we notice that the thumb doesn't fit appropriately, and it can become very confusing and possibly break that sterile field. So I'm going to go ahead and open up my sterile gloves. And I have my right hand and my left hand. My dominant hand is my right, so I'm going to go ahead and start this with my right hand first. So there's a nice cuff here that I can utilize with my clean hand. And I will gently slide my hand into this glove. Only touching the inner portion of the sterile glove. So now that I have my one glove on, I'm going to make sure I keep in mind that now the outside of the glove is sterile. So I'm going to slide my hand inside the cuff of my other glove like this. And then I'm going to place my hand directly in. And then if my cuff on this hand is folded down like mine is, I can slide my finger underneath the cuff and pull the glove up. And I now have my sterile gloves applied. Again, being sure that you note that your sterile glove packaging does not contaminate your sterile field. So now I can go ahead, I can touch my materials, I can play around here with my ABD pad, I can use my contact applicator, I can move my bowl to be sure that all of the supplies that I would need for this dressing change or invasive procedure is appropriate and in the available fashion that I may need it in. So once I am done conducting whatever procedure I needed sterile field for, I would go ahead and take off or remove my sterile gloves. So again, you have to be sure that you're mindful that bacteria and anything that you utilized your gloves for is on the outside of these gloves. So you're going to make sure that you don't want to contaminate now your skin with the material that's found on your gloves. So you're going to go ahead and pull these gloves away from you and ball them up into your other hand. Gently use your other hand and slide underneath the cuff of the glove and wrap your gloves together and discard. Thank you. Have a good day.